Hi girls! So as promised today, I'm going to be updating on the HSG that I did yesterday at the hospital. It was quite an experience to say the least. I'm really happy that I did it and that I went through it to make sure that everything was fine. As it turns out, everything was perfect. I'll get to the actual result in a minute, but first off, I'm going to start by just explaining the whole procedure, what my experience was with this particular procedure at this hospital. So I went in and they told me to take 2 Advils 1 hour before the procedure, so I did that. My boyfriend came with me, so we showed up to the hospital and we were seen right away. She gave me a hospital gown to wear. So I put that on and I had to remove all my bottoms, obviously. And I went in and I had to lay down on this machine. It's a bed with I guess it's an x-ray machine at the top as well. So first off, she takes a picture of the uterus area. And then after that, she explained to me the procedure really, really well. I was extremely happy about that. She was a young doctor, a woman with 2 assistants in the room as well. And she really went from A to Z. Everything that goes through, sorry, that's my cat. She went through everything that the procedure entails. So she started by saying how she's going to disinfect the area on the outside and then on the inside. And she's going to insert the metal, I don't remember what it's called, the metal instrument, and then the catheter and the balloon. So she explained to me everything, and I was really happy about that. Although I already knew what the procedure was, I was actually better hearing it from her. She started disinfecting, and that was fine. There was nothing wrong with that or painful. And after that, she inserted the metal object that actually opens up so she can start injecting put in the catheter to inject the iodine. So that was fine as well. No problems there. It's only when she inserts the actual catheter, the little tube inside the cervix, that is painful. I wouldn't say that it's unbearable pain, but it is uncomfortable enough to give cramps that do imitate period cramps. Maybe I would say a bit stronger than that, but breathing through the pain is really easy and it lasts really only a few minutes. So she did that, and then she told me when she was going to start injecting the iodine. So after that, she told me to lift my right butt cheek and then my left butt cheek so that the dye would go everywhere she needed it to go. And then it was done. She told me that I can get up, that I might have a bit of, some liquid that would leave. And then in about 7 to 10 minutes, she would have to take another x-ray to see how I evacuate the iodine from my system. After the 10-minute mark, I took another x-ray and I asked her if everything she saw was fine. She said everything looked absolutely great. No obstructions, nothing. The tubes were perfectly clear. That the dye the dye went through perfectly fine. And she said that the reason I'm not getting pregnant is definitely not due to a blockage or an issue with the actual anatomy there. So that was really awesome. I was glad to hear that. Although I didn't think there was a problem there, I wanted to rule that out and make sure that everything was fine. And I didn't even ask her anything after that. She's the one that actually told me, oh, I have a lot of patients that have successful pregnancies, the cycle with the HSG, because a lot of people, it's just a little matter or mucus that can stay behind in the tubes to prevent the sperm from actually going up. So she said that it can actually increase fertility by a slight margin. So not it's not like a fertility treatment, but it does have some success rates afterwards. So that I'm happy about that. I was expecting something of that sort, and now I'm just gonna wait on my boyfriend's semen analysis, which is going to be early April. That's not going to be for this cycle, and I'm debating if I do get pregnant this cycle. I'm not sure if we're going to go through the semen analysis. Seems kind of, useless to get it done if it does work out that we are pregnant this cycle. So we'll see how that goes. Today I'm on cycle day 10, and I started temping this morning. I'm also going to start OPKs in a few days' time. So we're going to get ready to baby dance starting this weekend. Should be fun. So I'm going to update you. The next time should be in the 2-week wait. So hopefully we'll see you then. Okay? Bye-bye.